So, that's the first time in 20 years that IMW is back in US soil, and I think it really points out to a disease, to a community which is really at a crossroad. A lot of excitement, new asset, new immune approaches, but also the need to become more precise, to get more 21st century tools in our assessment of outcomes and prognostic factors and classification. So where do you get that kind of data to get these assessment? And one way to do this is registries. We've heard a lot about registries. Takeda talked a bit about their INSIGHT registry. We've heard from Dr. Irene Gobriel about PCrowd and PROMISE. So similarly, in order to build the database, build the data necessary to make these best possible decision going forward about how you use these assets, how you combine them, we created a direct-to-patient registry where very simply a patient can consent online on a click, and this consent basically does a few things. First, it brings a mobile phlebotomist into their homes, and they give blood, and through this blood, now that we have this new liquid biopsy technology, we can do very in-depth genomic analyses as well as immune analyses. The other thing it does is it also releases the electronic medical record, and we can aggregate the electronic medical record of these patients, their entire history, for example, for over 20 years, thousands and thousands of pages. And once you accumulate all of that clinical immunogenomic data together, then we can start answering questions. So what's going on in these post-daratumumab patients? How is the immune system looks in those patients? How does it react to the genomic of these individuals? What might be the best strategies, the best combinations going forward? So it's a very exciting approach. It's also a way, quite frankly, to make patient active participant in the research rather than simply human subjects as they used to be. So a lot of promises there. And again, this is also a way to the patient, it's their own data. It's give them a chance to control what they do with their data. Sadly, today, patients are more than willing to give their data for research, but often that data stays siloed either within the biopharmaceutical companies who, for all kinds of reasons, some of them regulatory, cannot release that data for a long time. Sometimes it stays siloed within academic institutions, also for all kinds of reasons. So that's a way that patient can say, look, I want my data out there. I want my data to help the research as fast as possible. So yeah, next steps are basically we are just announcing here that this effort will be relaunching in research mode basically within the next couple weeks. And what we hope to do in the very near future is these assays that we are performing now in research mode, we will transitioning them to clinical grade assays. And that will allow us to basically return an actionable report to both the patient and the clinician. Again, the idea being that you want these patients to be engaged, and one of the best ways for them to be engaged to give them some information that they can do something with their own clinician is to return something like a clinical grade report. And that should happen in the spring of 2020.